Okay, thank you. And welcome once again to NSNU's webinar. So like I said, I'll first begin by a small introduction about NSNU. Let me just mute the ones who are not muted so that we don't have a disturbance. Okay. Uh, okay. So today's a webinar is about dental wellness and particularly around dental wellness for the elderly. So we have, as a speaker, Dr. Anshdha Shah, and she's a periodontist and implantologist working as a dental practitioner with an experience of about 9 years. She's worked closely with elderly people for their oral rehabilitation. So we will, in about the next 10 minutes, listen into her. The floor will primarily be hers, like I said, for the next 30, 40 minutes. But just prior to that, a little bit of, introduction about Naya Savera Nayumang for all those who are probably new to this webinar and haven't heard of Naya Savera Nayumang so far. So Naya Savera Nayumang, with the tagline of Beyond Years, Beyond Boundaries, Beyond Years because it's primarily meant to engage, empower, and benefit the elderly. But also, while we are at the moment present in three cities, Lucknow, Delhi NCR, and Kolkata, the vision, mission is to take it over the next 5 years or so beyond the boundaries of India, Bharat, so mostly in India, but also in a few cities outside of India. And in a very short summary of what do we do as NSNU. So this was established, NSNU was established with a profound commitment to further enhance the quality of life for our seniors and creating a collaborative space for professionals of all ages. So I think the latter part is equally important. So through NSNU, through Naya Savera Naya Umang, we do provide a platform for professionals of all ages to come together and in a win-win kind of mode, engage with each other, be it the young professional, the middle-aged professional, or the elderly professional, or the elderly, the one who was a professional at one point in time and has now retired. So this is how it all started. Very briefly, this is my story about 2 years back in August of 2023 when I was 59. I had moved, from overseas to India, and I was already involved in the social impact sector, but wanted to know more about what social impact sector was doing in India. So I decided to enroll in a social impact course. And it was during this course that I was amazed by the expanse of incredible work that grassroots Indian NGOs were doing to solve the myriad of social problems that India has always had for decades. And that's when I was also inspired, to work voluntarily for a cause. And I was already at the cusp of 60 and I was in no mood to hang my boots. So I thought, what better cause to drive than elderly care and engagement? And it's always been my firm belief that 60 plus is perhaps the most mature demography with loads of wisdom, experience, and knowledge behind them. And to retire the 60 plus from life would mean injustice to not only them, but to the larger society as well. And hence was born NSNU, Naya Savera, Nayumang. Clearly, it was not just me who was responsible for taking NSNU forward. There was a larger team, and we'll talk about the team also in a minute. So as we researched between August 2023 and 15th of August 2024, last year when we formally launched it, we looked at the various problems that the elderly have, and after a lot of deliberations within us as well as researching, we said the four main pain points of the elderly were these, which is as you age, There is health issues that obviously crop up as you sort of retire from active work. Your regular source of income is not there anymore. You have to dip into your savings, and then sooner or later, the inflation, the costs, they start biting. And then as people age even more, and with families becoming now nuclear, uh, yeah, I mean, there's increasing dependency that the elderly have to have, for small things on others. And they also have this issue which they have to address around combating loneliness. So these we said were like, the four generic pain points universally across, that the elderly kind of, have to address. And we said, what can we do, as NSNU to address these four pain points? So we said, let's first, look at what can be our, five focus pillars, somewhat like, the pancha pillars. Yeah. So we said health and well-being. Let's look at health and well-being as one of the pillars, community engagement. Let's look at estate and financial planning, advocacy and awareness, and collaborations and support. So everything we do is essentially around these five pillars. So today's, for example, is around health and well-being. In the past, we've been doing monthly events, physical events in every city that we are currently operating in, and will continue to do in every city that we step into. As well as through our webinars, we've basically been looking at one of these five focus pillars. And our offerings are, one is through events. So we do this physical event once a month in every city. We do a webinar, which is of course accessible globally. And then of course, through our platform, we uh, we try to also reach out other institutions which are like-minded institutions in the same space, because we do think that this is a sector like any other sector in the social impact sector, has opportunity for collaboration. So if we can collaborate with other like-minded institutions and partner with them and offer these partnerships to the platform, 2 plus 2 can actually be 5. And then, of course, the platform offers connects to each other. So the young can equally connect with the elderly. The elderly can also learn from the young. And it's like a two-way process. It's a win-win, for everybody. So this is where I briefly mentioned about, what we plan to do over the next 5 years or so. So we want to take it to 50 cities. We want to have about 100,000 people on our platform. Ideally, 50% of them as women. 50 cities, India and global. We want to be basically looking at collaborations day in and day out. So we want at least about 25 partnerships. And then I think in the process of doing this, we really don't need a very big team. I mean, what we need is actually more of a movement where people join in this movement passionately, wholeheartedly, and say, well, this is a good thing that you're doing. And let's join in. I mean, it could be like, as a volunteer, it could be as a city chapter, executive member. So currently, what we have is an advisory board. We do have an executive body, which is necessary as a compliance as a compliance thing, because we registered under the Indian Societies Act in Uttar Pradesh and Lucknow, which is where we started. We do have a lot of focus on communications because it's important for us to reach out to as many people as possible and be able to communicate what we're doing. And then, of course, we also do a lot of focus on research in terms of what is it that's already been done? Can we take it up to the next level? Can we do something different than that? Are there some new things that we can take up? I mean, eventually, the goal is all the same to be able to engage, empower, the elderly. And we then have the citywide chapter committees. So this is the governing board, which is like, 7 people. Apart from me, there's Sanjay Govil, Surinder Pawar, and Manoj Panwal. They're all based out of Lucknow. They all come with exemplary experience behind them, either in service or in business. But they're all professionals in their own rights. Uh, Balwinder, Ravi, Shronjon is based out of Calcutta. Balwinder is part Delhi, part Lucknow. But then, yeah, I mean, they're all like, people known to me over the last 40, 50 years and all professionals in their own right. We also have a very strong and a growing advisory board. So within that, we have Srimati Neena Agarwal, she's from Lucknow. There's Onkar, who's from the development sector. There is Srimati Madhu Kumar, who's also from Lucknow. There is Rakesh Gupta. There's Asish Srivastav. They're also currently based out of Lucknow, which is where we started. So we have a lot of people from Lucknow. But I think as we spread to other cities, we'll have a lot more other people joining in. And we're completely flexible on who can, come in on the advisory board, on chapter committee. So this is the Delhi NCR committee. We have Srimati Abha Gupta, Pankaj is there today on the call, Preeti, Puneet. They're all people from the professional world. We have the Kolkata committee, Shronjan, as I mentioned, Shujit, Rashekar, Kallol. Yeah. We also have, yeah, we also have, the what we call as volunteers, but basically we've termed them as community catalysts. And these are people who are just volunteering because they feel for the cause and they come in, to help out every other event, every other time. I mean, just, lending hand to the cause itself. So we have a strong communications research lead, and this is again somebody who's currently a student, but she's been handling all our social media handles. We also have a robust website. I encourage all of you to, go to the website, look at it. We have a podcast partner in Asit who runs a podcast, Good Site website and podcast. He's actually done a podcast on NSNU, and we will be sharing that podcast out so you can listen into that NSNU podcast as well. So these are some voices and videos of support from people I've known internationally. Uh, I'm not going to play them in the interest of time, but I mean, internationally, people have encouraged me that this is a noble cause. This is a good thing that you're doing. It's a need of the hour, not just in India, but universally. And yeah, yeah. So these are some photographs of some of the events that we did. Yeah, just very quickly, we also work closely
आवाज तो आ रही है यार
with the old age homes. Yeah. Uh, so these are some of the, and then of course our model is essentially through membership, which is an annual membership of 1,000 rupees, which is just a token sort of kind of commitment to the cause. Nothing great as an ask. There are quite a few of us who are also lifetime members, and that's like 10,000 rupees. And then for the 70 plus and the global citizens, at the moment we are not making membership mandatory. So essentially, I mean, it's left to them to see if they would like to, give something or donate something. So that's that really from my side. And let me stop sharing now so that I can, ask, I can ask Anshtha to probably, Dr. Anshtha Shah to probably come in and make her presentation. Like I mentioned, Dr. Anshtha Shah, she's also my niece. So, I mean, apart from being, a doctor, and we'll hear from her on dental wellness. I think it also excites me that, as a
ये
young
आवाज
doctor,
कैसे बढ़ेगी
as a young doctor, she is, you know, uh, she's basically associating with this cause and offering her services to be come on the webinar and speak about the topic today. So over to you, Anshta. You can share the screen. Yeah, yeah.
Okay, thank you. I hope I'm audible.
Yes, you are. We are able to listen to you.
Okay.
I have muted everybody excepting Dr. Anshta so that there's no background disturbance. So we'll hear from her for the next 30, 40 minutes. Yeah.
Okay, so good evening, everyone, and thank you so much, NSNU, for providing me this opportunity. So basically, I want to talk about healthy mouth and healthy body, and why oral health matters more as we age. So it is basically a small talk to sensitize why oral health is important and how we can maintain it in just by incorporating simple things in our daily life. So to begin with, it's a beautiful day to smile. Every day is a beautiful day to smile, provided you have a healthy smile. So coming to why oral health matters at any age is this is a concept that I'm sure all of us have heard at some point in life, that oral cavity is the mirror to the body. So a healthy mouth is paves the way for a healthy body, because everything that goes into your body is through your mouth. So this is basically the center, or the center pillar of the entire thing we are talking about today. So, briefly, I would like to discuss that how systemic diseases can cause problems in the oral cavity and vice versa. So, most of the diseases that as we grow old, so more diseases come into our lives, especially disease like diabetes, which is a lifestyle disease rampant all across the world, across age groups. So, diabetes is one disease which has a great impact on your oral cavity, and the condition of your oral cavity also has a great impact on the status of your diabetes. So we'll discuss it more, but just to be brief, then there are things like nutritional deficiencies. So a lot of nutritional deficiencies, especially vitamin B, vitamin C, vitamin D, all of these will affect your oral cavity in multiple ways, so which you may not be aware of. So there are a lot of symptoms in your oral cavity that you come across daily, but you cannot yourself join those dots to a underlying systemic problem. So a dentist, the intervention of a dentist is important over here. So then additionally, there are medications. So a lot of most of the people in old age groups are taking medications like
Yeah.
antidepressant medications, antihypertensive medications. So all these medications, they do have an effect on your oral cavity. They may cause symptoms like dry mouth. They may cause enlargement of your gums. And at this point of time, so it is important to report to a dentist so that it can be identified, the cause can be identified. Similarly, there are diseases like kidney diseases, liver diseases. So these can cause oral bad breath, what we call oral malodor. So all of these are small symptoms which we all come across in daily life, but we do not know how to distinguish whether it is because something in the oral cavity or something systemic. So moving on, I've shared a few symptoms which you commonly must be seeing, like recurring ulcers, dry mouth, cracked lips, burning mouth while eating spicy foods. Then we have a picture of gum enlargement, although very horrible to look at. But this is something that can be caused due to medications that you are taking, especially antidepressant medications, antihypertensive medications. Then people who may have had a transplant, who are on immunosuppressants. So all of these things, these can create a picture like this, which is very it's a tough thing to go through. With a simple change in medication, it can be corrected. So other things are like bleeding from gums, which is the most one of the most common symptoms, which more than likely may be related to a systemic disease. So here I have put in some articles, some work that people have done across the world, and the periodontal disease, which is actually gum disease, basically bleeding gums, friable gums. So this has been labeled as a sixth complication of diabetes mellitus. So it is that serious. The correlation between these two diseases is that serious that it has been labeled as the complication of diabetes mellitus. And this is a something which works both ways. Like here, I have put across how the oral status of the cavity, or the oral cavity, the oral hygiene that you maintain also affects your diabetes status. HbA1c, one concept that everybody knows, we all get it tested regularly. So there have been studies, and this is like a fairly recent study, but there have been studies in from 1980s as well, where oral hygiene has been directly linked to the status of diabetes. A well maintained oral cavity has been linked to a better controlled diabetic condition. So this is how important that nexus is, and to understand it, to give it importance is very important, and awareness is the key to all of this, to managing these things. Similarly, there are also coronary artery disease. We have all heard about heart problems, heart disease. So that is also directly linked to the oral cavity. So what happens is the at any point of time, your oral cavity is being inhabited by thousands of bacterial species. So what happens is, if you are suffering from a heart condition, which I mean, you are obviously aware of it, but what we are not aware of is that if our oral cavity gets inhabited by pathogenic bacteria, it can easily enter the bloodstream and reach our hearts. And this is especially dangerous for people who have had valvular surgeries, who have prosthetic heart valves. It can cause a serious infection. We keep on seeing reports of people dying from dental infections, of suffering heart attacks from dental infections. It is because of this entering of bacteria into the bloodstream. Now, this is not something to scare everybody, but then you should be aware that if you are suffering from some condition like a heart disease or lung disease, it is important to share it with your dentist. Because you may think that this is a condition that is not associated with dental problems, and the dentist does not need to know it, or the dentist does not need to know what medications you are taking. It's a myth, because the dentist needs to know what diseases you are suffering, what medications you are taking, and not only to prevent or to manage the disease, but also to alter the treatment. There are some medications or some procedures that the dentist may have to alter because you are taking other medicines or you are suffering from other diseases, like for example lung disease. So the entire respiratory system is in very close contact with your mouth. Obviously, we all know that. So what happens is, if you are suffering from a from like obstructive pulmonary disease or from pneumonia, so you are at a higher risk of contracting infections, respiratory infections from your oral infections. So all of this needs to be popularized, so that the public is aware, as well as the dentist you are going to should be aware of your conditions. So, systemic diseases affecting your oral health is not a one-way street. If the systemic disease is affecting the oral cavity, the status of the oral cavity will also affect the level of controls, or your managing the systemic diseases. Your oral health or the lack thereof will impact the systemic health equally. Underlying diseases can also alter the course and outcome of your dental treatment. For example, your dentist often, all those who have ever visited a dentist must have answered the question if they're suffering from diabetes. So that is because when a person is suffering from diabetes, they are likely to respond poorly to dental treatment. Your healing, your treatments may take longer as compared to people who are not suffering from diabetes. So you don't need to worry about the challenges if you are suffering from any such disease. So this was not to scare anybody, but to emphasize the fact that you only need to be aware about it, and so does your dentist. Make sure that your dentist is aware about your medical history, any surgeries that you may have had in the past, any allergies that you do suffer from, any treatments that you are currently undergoing. So all that is important. Now, coming to the second leg of the talk is what changes to expect in and around your mouth as you age. So, as we age, we all undergo changes. Our bodies undergo changes. We become slower in movements, and we have knees pain, back pains. So, similarly, the mouth also undergoes a lot of changes as you age. So, to highlight a few changes, the enamel, which is the outer surface of your tooth, undergoes wear and tear as you age. So this is a problem that most people do come with old age, do come to our clinics with, that they have sensitivity in their teeth, sensitivity to ice creams, cold food. Maybe some people even are sensitive to hot foods. So this is because your enamel is wearing off, and it is a relatively simple problem which can be easily treated. So it's entirely treatable. You just have to take a professional advice. So now, then again, dry mouth. So dry mouth, as I mentioned earlier, that some medications do cause dry mouth. So what happens is, although you may be able to manage dry mouth by drinking water or making yourself comfortable, it increases the risk of cavities. So that is one thing that you need to be aware of, that if you are feeling that your mouth is dry, you may have a chance of increased cavities. So you need to discuss it with a doctor on why why you are having dry mouth. Plus, there are additionally like salivary stimulating exercises or medicines that the doctor can give you to correct this problem. Then again, a very common problem with aging is receding gums. It's a fairly physiological phenomena that the gums will recede as you age. It may not happen to everyone, but it is entirely possible that it can happen to you. So it is a treatable condition. But what happens is that in the early stages of receding gums, there are no implications that you can feel. There will be no sensitivity, and the aesthetic aspect of it will not trouble you because you are not able to judge that your gums are receding. So, because this is a problem that always face in clinics, that when I highlight in the early stages of gum recession that they are having this problem, they are not ready to get it treated. But what they don't understand is that the earlier you treat it, the better chances of having 100% successful result. But by the time, this is a problem that does not cause any tangible problems in the early stages. So by the time you do realize that you are having a problem, the chances of a successful treatment have already become 50%. So it is that's why it's important to treat it as early as possible. Then thinning of oral tissues. So just like your enamel, your hard tissue, tooth surface is wearing, similarly your soft tissue is wearing. Your collagen that is also present in your skin. So just like collagen breakdown occurs on skin, you feel old. Similarly, inside the mouth, the collagen is also degrading. So it makes the tissue more prone to lesions and injuries. So this is something that is not avoidable as such, but it can be managed. The if there are any sharp teeth that you feel you are getting cuts somewhere, so you should talk about it to your dentist, because they can fix that. They can round off your sharp teeth and prevent any injuries to your tissues. So the biggest fear in old age is, am I going to lose my teeth? So since childhood, we keep grow up hearing that you will lose your teeth once you grow old. So is that the case? No, that is not the case. But like all things in life, this also comes with a few terms and conditions. So the most important condition is maintaining proper oral hygiene. So like 80% of your problems will not occur, or will be treated at the earliest stage if you maintain proper oral hygiene and regular dental checkup every either 6 months or 1 year. So that is entirely up to the situation of your oral cavity and your dentist. They may ask for a checkup every 3 months, 6 months, or 1 year. Then addressing the dental issues rather than avoiding them, because avoiding something doesn't make the problem go away. So that similarly, a dental, I mean, everybody is afraid of dentists. We are most fear fearsome people. People are afraid of us. They don't want to get their teeth treated. So but avoiding those issues is not going to fix them, but instead addressing those issues in the earlier stage is going to make the road easier for you. So, coming to maintaining proper oral hygiene, a lot of aids are available these days. We are always confused which one to use, what to use. So we'll discuss briefly about that also. Brushing twice daily is necessary, but it is not sufficient for maintaining adequate oral hygiene. There's always a question from people visiting the dental clinic: we brush at night, why are our teeth getting cavities? Why are we suffering this, that? So it is not just about brushing twice, but the quality of your brushing, how you are brushing, what you are using for brushing, that is important. So as one ages, a very specific problem arises. Spaces or gaps between teeth are created. So this problem, it begins, I think, in your 30s, in your 40s. It doesn't have to be in your 60s or 70s only, but it begins as early as 30s and 40s. That spaces are created and there is food lodgement, and these areas are not accessible by your regular toothbrush, and they need special agents to clean, like dental floss or interdental toothbrushes. This is one aspect of dental hygiene that I would like to stress upon, because this is a very underrated, a very avoided thing which nobody practices. So, flossing your teeth and interdental toothbrushes are of utmost importance. Rinsing your mouth after every meal or snack, it should be a habit. Inculcate this habit, make it a rule, because the coffee, even tea, coffee, whatever you take in, it is staining your teeth. And no amount of brushing, once the stains they set in, no amount of brushing is going to help you. So rinsing your mouth should be a habit, whether you eat a single toffee, you drink a single cup of tea, whatever it is, rinse your mouth after every meal, every drink. Then using mouthwashes. Now, I have seen people using mouthwashes just indiscriminately. So, mouthwashes are not necessary for each and every case, and they also have a lot of agents which can cause allergies, sensitivity, or they may even cause burning sensation. So and every mouthwash has a specific target. Like some mouthwashes are for plaque removal, some are for treating sensitivity of your teeth, some are for bad breath. So you need to select your mouthwash. In fact, you don't need to select it, your dentist needs to select a mouthwash that is curated for you. So indiscriminate use should be avoided, and only if prescribed it should be used. Now, coming to oral hygiene aids, the one thing that we all use, toothbrush. Now, toothbrush is something that we are using like very casually. We go to a chemist, whatever color we like. If my favorite color is pink, I'll go for the pink one. I'll go for the cheap one. I'll go for the expensive one. But that is not how a toothbrush should be selected. You need to be picky about selecting your toothbrush. So how to select the right one? So the ideal answer is consult your dentist. That is the best way to go about it, because they know what are the problems in your oral cavity, and they can prescribe you something according to that. So uh, okay, I have just stated here briefly the kind of toothbrushes that are available in the market. So, firstly, the thing that I would like to say is that choose a toothbrush. The size of the toothbrush matters. The part that goes inside your mouth, it should be of a size which is in accordance with your mouth. I mean, it should reach all the parts of your mouth, at the back, everywhere. You should be easily. It should not be so big or big that it's not able to reach all the areas. That is one thing related to size. And next is the bristles, which is the most important part of the toothbrush. So there are a lot of toothbrush types of bristles. It's basically hard, medium, and soft are the three kind of bristles that you get in the market. And they have done beautiful marketing. This is I've taken from a marketing site, from a online platform. So they have written ideal for deep cleaning and plaque removal for hard bristles. So is that so? It is not. Hard bristles toothbrush is something which is to be avoided. In my 8 years as a periodontist, I don't think I have prescribed a hard bristle toothbrush to anybody, because you don't need it. A toothbrush with hard bristles should not be chosen until it is prescribed to you by a dentist, because the hard bristles are causing more harm than they are doing good. You don't need it. This is for people who have an absolutely pristine gums and teeth, and who cannot apply a lot of force with their hands. So that is when the hard bristles come into play, which is not true for anybody really. Because you don't need that kind of bristles to clean your teeth. The medium bristles, this is a toothbrush which can be used when you are not having any problems with your gums, like bleeding or sensitive gums. This can be used, although not the most ideal thing, but it can be used, and it does not cause any problems. If you are comfortable with it, it is fine. um, Coming to soft bristles toothbrush. Now, the soft bristle toothbrush is the ideal kind of toothbrush, because the bristles are soft enough that they can bend and enter your gingiva, I mean, beneath the gums, and clean out the plaque from there. In small spaces, they can enter to a certain limit, and they do not cause any harm to your tooth surface or your gums. So, it is the most widely recommended type of toothbrush. Now, coming to this ultra soft toothbrush, so this is a new thing that it's not new, but it's widely popularized across with advertisements that it is ultra soft, it is good for your gums. So that is all just marketing, because it is not good for your gums. It is not recommended for daily brushing. It is the brands are constantly promoting them, but they are not cleaning anything actually. These brushes, they are specifically for a type of disease, gum disease, where the gums are actually that weak that they are friable enough to just fall off. The gums are literally falling off. That is the only condition where these toothbrushes are used, because they are very soft, and they are not that much successful in clearing of the plaque. So these ultra soft toothbrush, many people they think that this is what is good for their gums, but this is not. It is just not to be used until prescribed to you by a dentist. Also, I would like to highlight one thing that there is a lot of people come to us that they stop brushing if there is bleeding from gums. So don't do that. If your gums are bleeding, you don't have to stop brushing. If there is some dirty corner in your home, you don't stop cleaning it. You clean it with more vigor. So that is what needs to be done. If you have bleeding gums or some issues during brushing, you need to get them fixed. Stopping brushing is just going to make everything worse. I'll talk briefly about the powered electric toothbrushes. So this is a newer concept within India, more popular in the Western countries. So it has some indications and contraindications. There are basically two types of power toothbrushes with a vibrational motion and an oscillatory motion. So out of the two, the oscillatory motion power toothbrush are more recommended. So they're indicated primarily for physically handicapped patients or older patients who have reduced manual dexterity and may have difficulty in maneuvering a manual toothbrush. Then people with severe gum diseases who have like deep periodontal pockets, gum pockets, you must have heard, they can be prescribed a power toothbrush for better cleaning. If they're not able to not reach where the issues are, they're not able to clean properly or follow the instructions properly. So that is when these brushes are used. So but the list of contraindications is important because it should not be used when you are suffering from certain oral problems, like if you are having any swelling, ulcers, any abscess, infection, because it is going to spread that infection indiscriminately. It does not know when to be soft and when to be brush vigorously. That it cannot be controlled. It has a specific force and it will just brush uniformly like that. So then secondly, if you are suffering from any heart disease, like I mentioned, the bacteria can enter your bloodstream and reach your system. So if you are suffering from such conditions, you should avoid using power toothbrushes or at least discuss it with your dentist before using them. Then there have also been incidents reported of power toothbrushes having caused seizures in patients or the aura that precedes the seizure. So it is not recommended for epileptic patients. Then accidents have also been reported where the head of the toothbrush has broken off in the mouth. Then the last point, the leaching of metals from the toothbrush has been reported in some cases, although this is not true for all brands and all types of power toothbrushes, but it is something that has been reported. So it needs to be used carefully and not just because it is in trend. So, and discussing it with a dentist will obviously be a wise decision. So when choosing a power toothbrush, patient comfort is of utmost importance. Many people are not comfortable with using a power brush because it takes away your proprioception, manual proprioception, or brushing your teeth. Then a size appropriate should be chosen which reaches all parts of the oral cavity. And although studies have shown better plaque removal with power toothbrush, it does not actually have any clinical significance. It is not making a clinical impact. The manual toothbrushes and the power toothbrushes have similar actions. I mean, it is not statistically significant that power toothbrushes are the go-to thing and manual toothbrushes are not enough. If your brushing technique is good enough, if your brush is good enough, you are all set. You don't need a power toothbrush as such. Now, coming to interdental brushes, now the gaps that we have been discussing in the past few slides that we all have must have observed as we age, we are getting gaps in between teeth. So this is the interdental brushes are a very important aid in cleaning those spaces, of removing food and plaque from those spaces. So there are basically two designs. We have a straight interdental brush and we have a contralateral interdental brush. So the straight interdental brush is good enough for your front teeth, but when you approach the back teeth, it is you cannot. There is no ease of use is not there. The contralateral interdental brushes, however, they are easily usable. They because they have a head which is just like your normal toothbrush, so you can use it very easily. You just have to insert it between your two teeth wherever the gap is, and the food is just going to come out, or whatever plaque, debris, whatever is there is just going to come out. So it is an effective method to remove food particles, especially around dental crowns and bridges. If you have had any dental work done, there is a problem that most of the patients, they do come up within 5 years, 10 years, because the gums are adapting, they're receding, so spaces are created, and they have a problem that food is getting stuck around the gap. So these are the aids which you need to use to clean them and maintain those spaces. Otherwise, the adjoining teeth are also going to have cavities, and then you're going to have to get those treated as well. So I've tried to show the interdental spaces, or the gaps that can be seen in between teeth. So these are basically the kind of things that you will see. This is a very narrow gap. This is a moderate gap. This is a wide gap. Now, any gap which is less than this minimal narrow space, that can be cleaned by floss. You don't need an interdental brush because it will not go inside these spaces easily. So you don't need to force it in. You can use a dental floss for that. And for any space which is wider than this, the third space that is shown, you can use your manual brush, normal brush, to remove the space, because it is so wide, it is self cleansing. You can easily insert your normal brush in it, and you can achieve the goal. So these this is there are color coded and color coded interdental brushes are available for narrow spaces, medium spaces, and wide spaces. Although you can obviously consult your dentist on which to use, but even then I've tried to show you a dramatic representation of the spaces, so it is easier for you to choose your brush, the size of a brush. And these are pretty widely available on all commercial sites like Amazon, uh, everything. So moving to another interdental aid, so dental floss, the tiny minute spaces which are not yet visible to the naked eye, but food still gets stuck, or some small particles may get stuck. So they can be used to clean in between the teeth where the routine toothbrush is unable to reach. They have the same function as the interdental brushes, but used for very tight spaces, and it can be used in healthy teeth as well. You don't need to have spaces. The healthy teeth can also be cleaned to remove the plaque which is building up in between the teeth. Now, water pick, which is a relatively new concept. So basically, it uses a pressurized stream of water to remove the plaque that has accumulated on your tooth surface. So it is a better alternative for cleaning around the dental work like crowns, bridges, and dental implants. Contraindications include recent oral surgery and oral infections and inflammation. So cannot be used in all cases. Again, it should not be used by people who have prosthetic joints, prosthetic heart valves, or immunosuppressant states, because it may cause bacteremia. So this is something that you should not select on your own. You should first speak to your dentist if it is ideal for you, if it is needed for you, and then only go for such choice. Again, available commercially on platforms like Amazon, or yeah. So now coming to saving or losing your teeth as you grow old, what to do? I mean, if you are suffering, despite maintaining all your oral hygiene, if you are suffering from a problem, do you save those teeth, or you lose them as you grow old? So it is not necessary that you will lose your teeth. The primary goal is to save your teeth. So the fear that as one grows old, they're bound to lose their teeth needs to be checked at a young age. It is all about maintaining your teeth, and not only by hygiene practices, but again, professional input. Because despite your best efforts, sometimes you will get dental problems, but if they're treated early, you don't have to pull out your teeth. So letting go of the fear of dental treatment again is important, getting your issues identified and treated. Taking out teeth which can be fixed and replacing them may seem easier, but it is not. So this is something that some patients, they are very tired of getting the dental treatment done. It is not going at a pace of according to their wish. So they get frustrated, and they want that the diseased tooth should be taken out and just replaced. So it is not that easy, because what you have naturally is always will be a better option than what you can produce artificially. So what happens once you lose your teeth? So there are certain challenges you will face if you lose your teeth. Firstly, aesthetic challenges. So if we have all encountered people without any teeth who have a very collapsed lower third of the face. The vertical dimensions are all collapsed, cheeks sunken. So that is an aesthetic challenge you face if you lose all your teeth. Inability to chew a food, definitely that is a given, but also there is difficulty in speaking, in speech. Teeth, having teeth is very important for your phonetics as well. And here you can see, like, if you're not losing all your teeth, you are not going to have aesthetic challenges, and you're going to be able to chew food just fine, but only for a certain amount of time. If you do not replace your single missing tooth, all of the other teeth are going to get affected. You're going to create some spaces like these where ultimately it will be a space where food will get lodged, your nearby teeth will get cavities, your upper teeth or the teeth of the opposing arch is going to go loose. So a space collapse is seen within the oral cavity even after the loss of a single tooth. So what to do? What should you do when all your avenues have been explored and tooth extraction is your only answer? So, firstly, do not go ahead with tooth removal without a plan in place for tooth replacement. If your dentist has somehow suggested you to get your tooth extracted and they have not suggested a replacement option yet, you yourself must be aware enough to ask what will happen after that. How do I get my tooth replaced? It is something that you need to plan for beforehand. So as soon as you lose your teeth, you start losing your bone as well. All our teeth are inserted into the bone, and the beautiful thing about this bone is it appears in the human body after the teeth have appeared. So it is there only for the teeth. This bone that supports the teeth is only there for it. It comes into existence after our teeth start erupting as a child, and once we lose these teeth, the bone also we also start losing the bone. And the more you wait, the more difficult it will be to replace your teeth, because the bone is gone. Now there is no space to replace a teeth. Your bone has collapsed, your teeth, your arch is collapsing, your face is collapsing. So you have to plan ahead on how you are going to replace the tooth that you are about to lose. Now coming to tooth replacement options. So this is the age old replacement option that all our nightmares are made of: complete denture, when we have lost all our teeth. So it replaces the entire set of dentition. It is something which is removable replacement, so it needs to be removed every night and kept in water. uh, and then another thing about these complete dentures is that you need to have sufficient bone for a good denture that stays in your mouth. Because if you wait for a long period of time to get these dentures, your bone is going to get resorbed, and then the best of the dentists cannot make a very good denture. But then you'll have to compromise on your chewing ability, your confidence, everything is interlinked. And here also we have a removable partial denture, which is used to, which is similar as your complete denture. It is removable. You have to take it out, and but this is a partial denture, so it is to replace a single tooth. It can also be used to replace multiple teeth. Then it may also have. It is similar to complete denture. It has a pink coloration and a white tooth, but it may have metallic clasps to better retention. So these are your removable options. Then coming to fixed tooth replacement options. Now there are different types of fixed replacement options. Most of the people are going in for fixed options these days. So the fixed partial denture. So this is usually given to you when you have one or two teeth missing and you have adjacent tooth to support. So what
Uh,
is done is basically
Anshdha,
support stay. Yeah.
we have about 10 minutes left. Uh,
Okay. Okay.
yeah,
Alright.
I mean, I want to keep the last 5 minutes at least. We can extend the session by another 5 minutes. So take 10 minutes, and then I think we'll have to
Okay.
leave last 5 minutes for Q&A. People may have queries. Yeah, over to you.
All right.
Sorry.
Okay. Okay. Coming to fixed partial denture, so the thing is that you to go for this option, you need surrounding teeth which are stable enough to support the missing teeth. So it is a fixed appliance held in place by dental cement. You don't have to take it out, but efforts need to be made to maintain hygiene. So by the means of the interdental aids that we have discussed earlier, so those are important. Then the one thing that needs to be considered in this is that this is made of metal. So people who have to undergo frequent MRIs, who are suffering from any condition, they should go for a metal-free option. And if you have a metal crown in your tooth, metal anything, any dental work which is which has metal in it, so you need to tell your radiologist if you go for an MRI. So that needs to be discussed with your doctor, with your dentist, and needs to be kept in mind. Then coming to dental implants, which is the go-to treatment, dental treatment replacement, dental treatment for the replacement of teeth. So it can be used for replacement of a single tooth, for multiple tooth, or for the entire dentition in place of the complete denture. It consists of a surgical phase. So your dentist will explain it to you well. You have a surgical phase wherein the implant is inserted into your bone, which acts as a simulant to the root of the tooth that is there in your natural tooth. And the after the surgical phase, it is left to heal and to osseointegrate with the bone, to join with the bone, so that it can provide stability. So this is the best kind of tooth replacement because it keeps your bone stimulated. You don't lose bone much, of course, because of the surgical procedure. You will lose 1 to 2 millimeters of bone, that is normal, but you will not lose bone after the tooth loss that normally see, because your bone is engaged. So this is the most closest thing to your natural tooth that exists. So coming to overdentures, this is something when you lose all your teeth, but you want a fixed replacement option. So these are overdentures, complete dentures, which can either be fixed or can be removable dentures, but they have a dental implant, so that your bone structure remains intact. Your bone loss is, it's not there. And the removable dentures are usually, these are more only given to you when there is not sufficient bone. So fewer implants can be placed in strategic positions to support your entire dentition. So this is although this is a less expensive option, whereas the fixed overdenture would be a more expensive option because it requires 4, 6, or maybe even 8 implants to replace the entire dentition per jaw, depending upon your chewing force, your bone, other factors. So coming to the last leg of the presentation. So this is something that most people face. Like as you grow old, you are suggested exercises for your knees, backs, everything. So similarly, there are mouth exercises for old age. So if a person has lost most of their teeth or have been without them for a long period of time, it is likely that the muscles of the lips and cheek have lost their tone, the vertical collapse that we discussed earlier. So this is a situation that needs to be corrected for proper functioning with dentures, which can be done by means of facial exercises. These exercises mainly aim at restoring the muscle tone around the lips and the cheeks. And when these are also there to help you when you start using your dentures, you will need, otherwise you will not be able to adapt to those dentures after a long period of time. If it has been a long period of time, which usually is the case for complete dentures, because you don't lose your entire dentition overnight. It goes over a period of years. It takes, so there is a gradual collapse of the muscles. You lose your tone. So these are some exercises. So lip exercises like puckering of your lips and relaxing them. So repetition, 10 to 12 repetitions, 2 to 3 times a day. So these are all exercises that your dentist will explain to you. But if you have lost teeth or you are losing teeth, you can do these exercises to maintain the muscle tone of your face. So cheek exercises, blowing up of your cheeks and sucking them in. These are exercises that will help you maintain your muscle tone. Then tongue exercises are also useful for denture wearers, because you can do them by practicing sounds like T, D, N. So and by moving your tongue and touching it to your palate, to different positions in your mouth, right and left. Then coming to jaw exercises. So as you use your teeth, your jaw, the joint, the temporomandibular joint, I'll talk about that as well. So it also becomes stiff, like all joints in old age, they do become stiff. So jaw exercises can be very useful in maintaining a range of motion in adapting to your complete dentures that you get that you may take. So if there is any stiffness or pain while doing these exercises, you have to gently open your mouth. You can use your fingers to push your mouth open gently, and mind you, all these exercises need to be done very gently. And if there is any pain or stiffness, you can use your fingers to massage it lightly near the joint. So and side to side movements of the lower jaw, making wide circles with the lower jaw, helps in increasing the range of motion and overcoming stiffness. Many people also experience stiffness after waking up. They have pain in their jaws. So all this small jaw exercises, light jaw exercises can be done. Make sure you get your dentist to train you in doing these exercises, and not it should not be something that is self-taught. Then discussing the temporomandibular joint. So it is the joint which connects your jaw to the skull and allows for all the movements such as chewing, yawning, and speaking. So all the movements that you do in your face, because it's the only movable joint, movable bone in your face, the mandible, the lower jaw. So in old age, due to tooth loss or worn or ill-fitting dentures, due to arthritis, clenching or grinding of teeth, and weakening facial muscles, they may cause TMJ issues like pain or tenderness around the jaws or the ears, difficulty in opening your mouth fully, a clicking or a popping sound when moving the jaws, headaches, neck pain, or pain while chewing. So these issues can be rectified by gentle jaw exercises and warm compress. In severe cases, a dentist may also prescribe some anti-inflammatory or muscle relaxant drugs, but make sure to take a professional opinion before you do any of these exercises. So this is joint is basically 1 centimeter in front of your ear. A lot of people have soreness, pain in the TMJs, and so these are a few pictures I have shown of warm compresses. Not all of them are correct. This is not where you place it. You have to place it over the joint, and definitely you have to like consult your dentist before you do any of these at home. So on a parting note, a clean and cared for mouth helps prevent diseases and improves speech and makes eating more enjoyable. Do not ignore the discomfort, dryness, or changes in your mouth. Early care makes a big difference. And most importantly, you are never too old to take care of your smile. So thank you all for listening so patiently, and keep smiling. And I hope this has been a useful lecture.
It has been. I mean, I think there's no doubt it's been a very useful session. More because you explained, the medical language, which most people would not understand. I mean, unless, they are in the medical profession, to most of the people in the audience who are probably laymen. But I think, yeah, prevention is better than cure. But then if it comes to a problem, then I think the advice from Dr. Anshdha is that don't delay in taking professional advice rather than, trying to sort of cure or delay the cure. So with that, I'll just maybe open it up for any questions or any comments that anybody may have. Please unmute yourself. You may want to come on the video if you feel like, and then ask the question or comment directly for Dr. Anshdha.
Hello, this is Dr. Mitra from Cleveland, USA. Can you hear me?
Yes, we can. Dr. Anshdha, can you hear us?
Yes.
Go ahead, please.
Yeah, I can hear you.
This was a wonderful talk, very, very informative. And even at this stage of life, there were few things which I was not aware of. So it was really very, very helpful. I don't know. It might not be very relevant to this talk because this was predominantly about preventive things and not cosmetic. But I was just wanting to ask you if use of serum for whitening of teeth is something recommended or it's not a good thing. Because with aging, I understand it's normal for teeth to get a little bit like a stained appearance, or the white appearance will gradually go away with age. Is that true? And is application of serum a good thing?
Yes, you're absolutely correct, ma'am. As you age, because of the outer covering, the enamel which we spoke about, so that wears off and it leaves behind a yellow discoloration, your yellow coloration, as you may say. So that is perfectly natural. It is the color of the layer which is underneath the enamel, and a lot of people have a generally thinner enamel, so they will have a yellowish appearance in teeth, and
Right.
going for cosmetic treatment, or I have seen many people using these abrasive toothpastes which promise to provide tooth whitening, is not very advisable, because what it does is it does not whiten anything, it erodes the enamel more. So
Mm.
avoiding these is a better option. But if you are using something like that, showing it to your dentist and discussing with them is okay. I mean, if they suggest that you can go ahead with it, then it's fine. But otherwise, it is something that should be avoided, unless because most of the staining, if there is some external staining, because which is because of some other reason like food materials or smoking, so these can be taken care of professionally, and you don't
Sure.
need to apply in-house things, especially without any consultation, the
Sure.
commercial products. So that is not advisable.
Yeah, yeah. I was not thinking of anything to abrade it. It was more like a. They said that you can apply something like a whitening agent. So I was just wondering if that's a good thing to do or maybe not.
If it is prescribed to you by a dentist, because there are certain whitening agents which are chemical whitening agents, your dentist will prescribe them to you for your
Sure.
application at home. So
Yeah, yeah.
don't
Thank you so.
you should always consult your dentist, like what you are
Yes,
using.
correct, correct. Thank you so much.
Okay, well,
There's one more question that, actually my friend, he was wanting to join in this webinar, but could not join. So he said, Sami, can you please ask Dr. Anshdha on my behalf? So I don't know. I don't know whether, something like this is available, but he said, like, a water jet using after, you've eaten your meals. Is that something you recommend? I mean, is there like a water jet which can be used on the teeth to sort of
yeah.
remove the
So the
food
water which I
particles?
spoke about, I spoke about a water pick. So that is the same thing as a water jet. It is basically a pressurized water stream which is used for teeth cleaning, and it is a good aid for cleaning deep spaces, provided you do not have any conditions which are contraindicatory to its use. So prior to use, you should just consult with your doctor once if it's okay for you to use or not.
Okay. Yeah. And then Ravi on the chat is asking how effective is mouthwash? And I think you spoke about mouthwashes, that it should not be used discriminatorily, but maybe you want
Yeah,
to
I
answer it.
spoke. Yeah, so I spoke about mouthwashes. So mouthwashes are effective if you are having an increased plaque buildup, or if you are having bad breath, or if you are having certain problem, which is your doctor can prescribe you a mouthwash that treats that specific problem. So and you can use it provided it is not containing any allergens, because a lot of people have allergies to cinnamon and peppermint, all these condiments which are widely used in mouthwashes. So you need to be just mindful of it. It's not something that I will say that I have to be against it or for it, but if it's okay for you and advisable, so you can use it then.
Thank you very much. I think with that, we'll probably have to end the session. I mean, I do know 1 hour is not enough for dental care. Maybe one of these days, we should look at getting everybody in one room and spend, a couple of hours with Dr. Anshdha and maybe some more dental experts, so that not only they can let the group know about what precautions to take, so that the teeth and the smile can be good for longer duration, but also if it comes to care, then what care is needed, what professional advice can be taken, when and how and where. So with that, we'll end the session. But thank you very much, Dr. Anshtha, for this wonderful presentation. explaining it particularly, as I said, in a layman's language. So we will leave it at that. And until the next webinar, until our next physical event, we see you there again. Thank you very much, everybody who's joined today. I will stop the recording now.
Thank you.
Thank you,
Thank you, everybody. Thank you.